Hello, my name is Nate. I'm going to be discussing today what is consciousness. So consciousness, by definition, is the awareness in the moment, everything you think, feel, and sense of your environment around you. Consciousness is not only being awake or being asleep, but you can also be in altered states of consciousness. And one of these is circadian rhythms. And what circadian rhythms are, it's basically your body's natural time clock. So it regulates when you go to sleep, when you eat, when you wake, those things. From personal experience, a couple years ago when I first started my personal training job at Gold's Gym, I immediately went from getting up at 10, 11 in the morning or later to having to get up by 4:30 or 4 to be at the gym by 5 and 6 a.m. for sessions. So instantly, right away, I lost 4 to 5 hours of sleep, which made me feel very sleepy in the mornings, which led to lack of mental clarity and focus, which also led to me using more caffeine supplements than I would have previously used, which also then caused me to not be able to get to sleep at the time that I wanted to get up early again the next day. So this negatively affected my circadian rhythms, and they've also shown that some people have experienced memory loss from this happening as well, although this has not personally happened to me. As far as meditation and hypnosis go, some of the effects on the body and mind that these will have, they have been shown to improve things such as anxiety. There have been a recent study that have actually shown patients that were involved in what was called mindfully based meditation was shown to immediately decrease their symptoms of anxiety. So also what I recommend as far as someone dealing with anxiety, what I recommend these things to them. However, I would not recommend hypnosis. However, I would recommend meditation and prayer. These are some things that I've found personally to help me deal with anxiety. As far as drugs go and how they affect your neurotransmitter system, there are basically three different groups of drugs. There's depressants, stimulants, and opiates. Stimulants are basically drugs that basically speed up everything. They increase heart rate, increase blood pressure, increase brain activity, cause a feeling of euphoria, these kind of things. Examples of these would be things like caffeine, Adderall, Ritalin. All these drugs are fairly well known as common stimulants. Opiates are basically painkillers, which block the signals of pain to the brain. Things like Oxycontin, morphine, Vicodin, things like that. Depressants are drugs that slow things down and inhibits brain activity by causing a drowsy, calming effect. So things like alcohol would be a good example of this. And as far as my recommendation goes to a teenager about using these substances, I would recommend that they do not use or abuse these substances without a medical prescription from a doctor, because there are uses for these things for people that do have medical issues. These drugs can be used for that, but at the same time, these drugs can be very addictive, and I would tell a teenager that it could further limit their future development into adulthood by doing this. So that concludes this discussion.